We are still in a pandemic. So many of our city's children are hungry, scared, or grieving, and yet these basic needs are being ignored. So many teachers have young children of their own or are taking care of their elderly family, yet these concerns are being disregarded. We cannot pretend this pandemic away. Our school leaders and city leaders must listen and engage. For once, approach this pandemic with the humility, patience, and flexibility that you've expected from us. Thank you.
Okay.
It's now my honor and pleasure to present Dulce Garduño. Dulce is a board member of the Pilsen Alliance. She is a CPS parent and a former local school council member. Thank you, Dulce.
Thank you. My name is Dulce Garduño. I'm here regarding about all this issue with CPS. We need be accountable for the city. We need to accountable for CPS. We are parents. We should support. Many parents are working too hard and other ones should be in home because they don't have other options. We need to accountable for everyone in this city. The most important thing is we need vaccines. We need vaccines in the school. So many kids, they are in a home for many months, 18. So we need to keep accountable and we need to pray almost for the next step. It's the vaccine for the kids and it's here. But what we're gonna do if we can go outside with the kids, but they are sick? It's too many things coming from this city. Gonna be cold and the parents don't have paid rent. We need support. We need support in the school. We need support for the tests in the schools. Please, it's very important. Mental health. The most important thing is mental health for the kids. We need to go back to the school and opportunities for being remote or presential. It's very important for the parents have it being inside to the schools. How? Helping in the kitchens. We need to remove the commitments with other companies. We need to be accountable in the schools. Today I'm here because I have other issue very important for me. This pandemic make orphans, many kids in this country. How many kids lost both parents or one? The support. Sometimes foster parents don't have space. We are full of kids. Please, we need to do something with these kids. Remote learn for essential options for the parents. Thank you.
Woohoo!
Yes.
Thank you, Dulce. It's now our honor to present Deacon Dion Fleming, who's one of the leaders of the Illinois Poor People's Campaign. Thank you for being with us, Deacon.
Thank you, Doc. Hello, everyone. My name is Deacon Dion Fleming. I'm one of the choir chairs for the Illinois Poor People's Campaign. My glasses are fogged up. I can't see nothing. All right, here we go. I'm standing here with the People's Response Network
Yes.
to support Chicago Public School parents,
Dulce, myself,
community leaders, teachers, and elected officials to demand that the city of Chicago
primero
and
Dulce,
CPS
después
officials
yo.
take
Gracias.
immediate action now so that vaccine centers can be created for all within the communities and neighborhoods where these schools are. It's a great idea. It's exactly what they did back in the 1850s when another pandemic passed through the globe and killed untold amount of people. But it was going door to door and inoculating students in schools that saved the day. School-based mass vaccinations is one essential way, yes, to move closer toward racial equity, to decrease infections, long COVID-19 symptoms, hospitalization, and yes, even death. Death that can be avoided. So I ask you, Reverend Barber and Reverend Theo Harris ask this all the time. Whose side are you on? Whose side are you on?
We're on the
Are you
people's
on the
side.
children's side? Are you on the parents' side?
Yes.
Are you on the community side?
Yes.
Then stand up and do something about it. Start walking into these schools and demanding the resources that you deserve. The Poor People's Campaign stands with you. We will walk with you. We will walk with you in your neighborhoods and register you to vote. We will mobilize you to do more because we believe forward together and not one step back. Don't be scared. Don't be afraid. Be encouraged because God is with us on this one, folks. God is with us on this one. God bless you.
God bless you, sir. Thank you.
Thank you.
Next, we have Dr. Raul Contreras, the professor and chair of Latino Studies at Indiana University, Gary, and the co-founder of Meet the Ethan Neighbors. Thank you, Dr. Contreras.
Good morning. I'm Raul Contreras, and I'm here today. Well, maybe I'll start there. By day, I work and teach at Indiana University Northwest. I teach Latino studies, and a very important topic, especially these days, is something that comes under the heading of racial disparities. See, that's what I do during the day. And during the night, I go home and live racial disparities right there in Little Village. I'm here representing Little Village. I'm here representing Vidinita, community organization that's working on these issues for 2.5 years now. I'm here in solidarity with the People's Response Network and in solidarity with all 7 of its demands that are being presented here. I'm here in solidarity with the other community organizations represented here. We're wide. We're representing a number of communities throughout the city. We are the people. We are the people's voice. And I'm here in solidarity with that. I'm also here as a person who last week celebrated the beginning of my 75th year of walking this planet. And I'm here to represent children who are not going to live to be 20 years old, who are not going to live 1/4 of the years that I got. And they're going to die to the extent that the demands we're making are not met. And they're going to live to the extent that the demands we're making are implemented. That's why I'm here. I support of all 7 demands, but I particularly want to emphasize and talk about the need of historically proven technique of using the schools, the public institutions as vaccination centers. All schools in Chicago that are open should be open and prepared to be vaccination centers. All students, all teachers, all staff, all faculty, everybody that's going into that school should be vaccinated. I'm here in support of that in particular. I'm here to like with the group here, to demand the city has received $2 billion to deal with COVID, and it's fuddling all over about how to do it. All $2 billion of those dollars got to be put into battling COVID and in supporting and implementing the 7 demands and more that we're bringing forward. I want to really emphasize the importance in terms of community building, that it should be people from the communities who are hired to be contact tracers to implement making the schools safe. That should be a number one. I'm here to, in particular, to speak for the demand that ensure that there has to be sure that everyone is who's going to be going to the schools is vaccinated and tested weekly. I'm going to leave it there. I hope you'll help us in moving forward with these goals and demands and what we're trying to accomplish. Thank you.
Thank you very much, Dr. Contreras. It's our honor now to present one of the most active members of the People's Response Network, a lifelong resident of Chicago, who's also established one of the most important social justice networks online over the last year, Lauren Taylor. Thank you, Lauren.
We're here about the schools, but the other thing that People's Network is about, global eradication now. And I don't mean next week or next month. I'm talking about right now. You know, one of the things that we don't talk enough about, okay, yeah, we do want people to get vaccinated, but the companies that are making these vaccines, they got a little bit of responsibility that they need to have too, okay? Basically, I guess outside of the United States, for instance, in Africa, you still have only maybe like 1% of the people who have been vaccinated. And I think it's something like, 70-80% of all the people who have been fully vaccinated are in about like 10 countries, right? So we got a lot that we have to do with that. I mean, one of the founders of Moderna, right, is worth $4 billion as a result of this, okay? So we really, yeah, you know what I'm saying, right? And so we really, we need to do more with that. Like I say, global eradication now. But this is America, right? Americans, they kind of need something that is easy to digest, you know, easy to kind of wrap their heads around. So today is, you could say, the world premiere, or the debut of the new People's Response Network slogan, okay? And it's pretty simple. Don't hate on those who vaccinate. Don't wait, eradicate. But actually, I kind of got that a little bit backwards. So don't wait, eradicate. Don't hate on those who vaccinate. Okay, you ready? You guys ready?
Yep.
1, 2, 1, 2, 3, 4. Don't wait, eradicate. Don't hate on those who vaccinate. Don't wait, eradicate. Don't hate on those who vaccinate. Louder. Don't wait, eradicate. Don't hate on those who vaccinate. Last time. Don't wait, eradicate. Don't hate on those who vaccinate. Yeah. Give yourselves a big hand. Hey, global eradication now.
Just move it. Just get your hand out of the way. Yep. Thank you very much, Lauren. That's the first of many chants and songs from the People's Response Network choir that Lauren's going to help us put together. Again, my name is Dr. Howard Ehrman. I'm the former Assistant Health Commissioner here in Chicago, appointed by Mayor Harrell in Washington in 1985 and serving until 1991. Last week on Thursday, Dr. Anthony Fauci, who's been the most public spokesman as a scientist and a physician in our country, said very clearly, since May, the rate of infections, the rate of hospitalizations, and everything else among children is the same as adults. The myth that children don't get sick, that children don't get hospitalized, and children don't die, has been busted by the leading spokesperson in the United States. I'm going to read a couple of statistics here that are really key. Number one,
Make it exciting.
in the last 3 months, 240 children have died. Since this began in January of 2020, 600 children have died. At an accelerating rate of hospitalizations, thousands of children who never knew they were sick are now in Chicago and the rest of the country with symptoms of long COVID. They have foggy brains, they have muscle aches, and they're depressed. This is the reality, not the lies that you hear out of the mouth of the governor of Illinois, who says maybe we should take off our mask by Thanksgiving, not the lies of the mayor of Chicago, who basically says it's okay not to vaccinate kids in school, and certainly not the lies of the health commissioner, who basically says you should go to your doctor and to a local pharmacy to get vaccinated. So let's talk about the reality that all of us from the south, southwest side, and west side know. Every African American, Latino, and Native American zip code in the United States has half as many or less pharmacies, clinics, hospitals, and doctor's offices. Less than half. What does the President of the United States, the Governor of Illinois, Pritzker, and Mayor Lightfoot say? Go to your doctor. Take off from work. Get fired from your job. Take your kid out of school and go get them vaccinated. We are not going to allow that to happen. We are going to demand and do whatever it takes to get schools open up as vaccine centers.
Yeah.
5 hours a day,
Vaccinate
7 days a
schools.
week. And as our brother, Dr. Contreras said, we're going to hire local parents from that school to work on vaccinations, contact tracing, and more. This is what that Board of Education's got to decide at 10:30 today. Okay, and we're going to keep coming here. We're going to do whatever it takes to make that happen. What does it mean if it doesn't happen? Well, we know already what it means if it doesn't happen. We are at the point of 6 months. 6 months since 12 to 18-year-olds could get vaccinated. What are the statistics in this country? Less than half are fully vaccinated 6 months later. But only 1/3 of African American and Latino youth, including in CPS schools, are vaccinated. Why is that? Because instead of CPS following the lead of the only public agency in the country that did things right, the Los Angeles Unified School District, which made a commitment to go to every single school to vaccinate kids, which they've done, and to do testing every week, mandatory testing of every student and every staff and every teacher. What has CPS done? Well, everybody here knows what they've done. Nothing except to create a bigger mess. What does that mean? They have 4 schools, 4 out of 638 that are open for walk-in vaccines. Only 4.
How many
They
hours?
have
How many
failed.
schools out of
638. They have failed week after week with excuse after excuse from the mayor, from the health commissioner, from the new CEO to basically do mandatory testing. They have failed in that. They have failed to do contact tracing, and they have lied publicly. Dr. Arwade has lied when she said it's up to the parents to notify the schools and the Department of Health if they get sick from somebody in isolation and quarantine. That's a lie. That's not how contact tracing works. Contact tracing works means the school system and the Department of Health are supposed to talk to the parents and anybody else in the household to see if they're getting sick. What happened? 2 mothers tragically died at Jensen School. 2 mothers. This is genocide. We charge genocide against the federal government, against the state of Illinois, against the city of Chicago, and against CPS. Thank you very much.
That's right.
Dr. Howard.
I'd now like
Right,
to
Dr.
introduce a longtime activist and fighter for justice in Chicago, Paul Siegel.
Paul Siegel.
He's a board member of Northside Action for Justice.
Yeah, Paul. Paul.
Hey, okay. I just want to say that we've had 6,000 deaths now in Chicago from COVID. And I want to ask how many years of gun violence would it take to get it up to 6,000 deaths by gun violence? So how is it, from a public safety point of view, that the police department takes up 37% of the budget of the city of Chicago, and the Chicago Department of Public Health lives from one grant proposal to the next? How is it that those in power in this city and this country have so dismally failed to meet the challenge of this pandemic? Now, in the latest incarnation of that failure, we had the hasty reopening of the Chicago public schools, unplanned, inadequate protective equipment in the schools, inadequate cleaning supplies, no plan for real ventilation, construction going on so that if you're lucky enough to be able to open your windows in the classroom, you've got construction pollution coming in and you have to close them. We've got all these unvaccinated children in the schools in unsafe conditions, trading around the virus like baseball cards, which will then be brought home to the communities. We have already seen false optimism in the years of this pandemic has been here, and now we're seeing more of it. Only now it's more clearly the lives of our children that are at stake. So I just want to say, remember that you saw Courtney and Dulce today, and you didn't see Wilma Pittman, a great LSC member and grandparent who couldn't be here today, because in the face of this failure by those who are responsible for the safety and health of the public, there will arise a mighty movement led by parents and students who will give the lead to the teachers, and we will demand that the public schools become not death factories, which they threaten to become now, but hubs of community-based public health, of people cooperating and working together. And they will be open to vaccinate every child in the school. Don't pull, not to make the parents go somewhere else. Vaccinate them in the schools. That's how I was vaccinated for polio way back in some other century when I was 9 years old. In the schools. That's how we eradicated public polio. So we have got to fight for public health, and it is the parents and the students who are going to lead and who are going to shake this city to its foundations, if that is what is necessary to properly deal with this pandemic. Thank you very much.
That's right.
Okay, I'm really happy they gave me the pleasure of it. I love this woman to bits because she is just one of the most tireless fighters that we've got out there. Kathy Powers, who's from Rogers Park and the Alliance of Community Services. Really, come on up here and let the people know what talk to the people, Kathy. Yeah.
I'm going to talk to you. I was here last month, and I sat in the room with the board, and the vice president of the board was positive for COVID. Nobody has talked about it. Nobody's brought anything up, and I don't know. I don't think it's safe to go in there. Who's watching the store? We're watching the store, and nobody's listening to us. They had the vice president of the board of CPS was positive for COVID. But since he already had his shots, he felt it was okay for him that he was safe enough. And I don't know what his members sat next to him thought about it, or if they knew, but he actually said out loud that he was there because his children were home on quarantine because he was positive for COVID. Give me a break. And Dr. Quack Quack in this city, forget it. Thank you.
Thank you, Kathy.
I was going to say, Kathy's going to tell you like it is. Okay, is this our last speaker? Okay, our last speaker, somebody else that I learned a lot from, right? Because he's definitely been one of the tireless fighters that's been out here for a long time. Neil Resnikoff, Chicago Anti-War Coalition.
Woo! We need to act now, fast. Over 700,000 people in the U.S. have died already unnecessarily from COVID-19. The ruling class has not done a damn thing of any seriousness. There are 73,000 new cases of COVID-19 every day. In Chicago this week, there are 300 new cases a day and 3 deaths a day. In the world, nearly 5 million people have died unnecessarily from COVID-19. the U.S. corporations still do not make an all-out effort to make vaccines available worldwide or to remove patent obstacles so that other countries can manufacture the vaccines themselves.
That's right.
So one way to act now, fast, is to insist that students should not be in school unless they're vaccinated and the staff is vaccinated, and the same is true of workers on their jobs, especially among the most vulnerable African American and Latinx communities. We know that the vaccines are effective. Don't we need to ensure that the schools are safe and the workplaces are safe?
That's our
Yes.
job.
And
That's
should-
our job.
And should we help out the rest of the world, especially the poor countries of Africa, Asia, and Latin America?
Right.
And should we have contact tracing to see who else might have got the COVID-19? We need to join with the People's Response Network, the Chicago Teachers Union, and all those who are insisting that the Chicago public schools carry out these protocols. Do you agree?
Yes.
And while we are at it, how about demanding a new, reinvigorated public health department? It's been hollowed out over the years. Thank you.
Thank you, Neil.
Thanks, Neil. So before we wrap up, we just want to know, any questions? Anyone have any questions? Okay, I mean, there's a lot to know and a lot to learn here. I mean, and that's what we're here for, you know, information, support. I mean, we know that there is some, you know, reluctance, some skepticism. As I say, you know, we also want to call, as Neil is saying, you know, the vaccines are effective, but we also want to, you know, keep the pharmaceuticals and the people that are making these vaccines effective so that they really do, you know, get to the people. One of the things that I was also reminded to talk to you about before we wrap up, CPS has the money for this. We are not, there's nothing that we're talking about. There's nothing that we're talking about now that they can't do, right? CPS is sitting on something like $2 billion that the feds gave them, that they've gotten from the federal government. So they have the money and they have the ability to do this. Okay, so that's all we're asking. Now, as I said, before we wrap up, any questions?
We don't have to live with COVID.
Okay,
No.
folks, global eradication now. Thank you.
Okay.
Thank you.
Do you have a microphone now?
Yeah.
Okay. Dulce, adelante, compañera. We're going to now, Dulce and myself, we're going to just speak briefly in Spanish. Go ahead, Dulce. En español.
NBC, do you speak Spanish?
They call this back.
Adelante. Go ahead.
Yo la entrevisto uno a uno, one on one.
Como tú quieres.
Porque se van a llevar el...
Oh, ok. ¿Tiene micrófono en la cámara? Ok.
Aquí lo tengo.
Ah, ok.
Ay, ¿qué decía ahí mismito? Déjame bajar la estatura.
Yes.
For anybody who wants to stay for coffee or tea, we're going to get together as soon as Dulce is done. Yeah, I didn't even know that.
Okay.
What you said, I didn't know that.
You didn't know that?
Sí, se me dijo a mí.
Yes.
Cuando estés lista, me dices.
Almost.
Con calma.
Disculpa, ¿cómo se llama usted?
Chris,
Chris.
Yeah.
Mucho gusto, Howard.
mucho gusto. Yo creo que yo lo entrevisté una vez allá adentro.
Ah, ok.
Cuando entré al concilio allá adentro.
¿Tú eres de dónde?
De Puerto Rico.
Parece que sí.
Ajá.
Qué bonita.
El acento me
El
delata.
acento, perfecto.
Ya estoy lista, me
¿De qué parte de isla?
soy de Caguas.
Ah,
Está a 2 municipios arriba de, no, abajo de San Juan.
El primer puertorriqueño que graduó aquí en la Universidad de Illinois, en la Escuela de Medicina, fue un compañero mío de Ponce,
Oh, mira.
Daniel Sánchez.
Yeah. Estamos en todos lados.
Sí.
¿Lista? Grabando, me miras a mí. Para récord, dime tu nombre completo.
Mi nombre es Dulce Garduño.
¿Y de qué organización representas?
Pilsen Alliance, People Response, and Mi Villita.
Ok. Dulce, para hacerlo más resumido, cuéntame lo que está pasando hoy aquí.
Bueno, hoy nos estamos reuniendo porque estamos demandando algunas cosas para CPS. Una de las cosas más importantes es necesitan los padres tener opciones, ya sea educación remota o presencial o ambas. Es importante para nosotros que los padres tengan opción porque muchos de ellos han estado trabajando mucho tiempo y la otra parte no tiene trabajo. Entonces es importante que ellos tengan opciones. Hemos estado esperando mucho tiempo y se supone que estuvieron 6 meses para presentar todo esto y no se ha presentado nada a la altura de lo que debería de haberse hecho.
Y para los padres que quieran apoyar a la causa, ¿de qué pueden hacer?
Bueno, ellos pueden buscarnos. Estamos en Mi Villita, estamos como People Response también o por medio de la Alianza de Dios.
¿Y un mensaje que quieras decir?
Bueno, es importante para esta ciudad que sepa que los latinos somos responsables de lo que estamos haciendo. Somos una gran población que queremos tener la responsabilidad de, así como contribuimos a esta ciudad, también necesitamos una respuesta. Necesitamos que nuestros hijos tengan la educación que se tiene en todos lados, la educación que merecemos. Nosotros también pagamos impuestos. Y algo que es muy importante para mí es necesitamos saber que muchos de los niños están teniendo pérdidas de padres de un lado o muchas veces los dos papás. ¿Qué vamos a hacer con estos niños? Como sociedad tenemos que soportar esta parte. Aproximadamente se cuenta que tenemos 1 millón de niños en la orfandad. Es importante tener apoyo, pero imagínate si no tienen apoyo. Y otra cosa que es importante, y es muy importante para mí, tú no puedes tener casa, ¿ok? Probablemente la ciudad te provea un espacio, pero ¿qué pasa con la comida dentro de las escuelas? La comida es algo muy importante y si estamos teniendo compañías que no nos están proveyendo buena comida, ¿qué es lo que va a pasar? Necesitamos que las escuelas se abran y con la ayuda de los padres. Y los padres pueden ser contratados, al igual que abrir las escuelas 7 días de la semana para la vacunación. Los niños no tienen que ir a otro lugar, solamente vacunarse dentro de las escuelas.
Gracias.
Gracias a ti.
Ahora usted.
¿Puedes tomar este video?
Claro que sí.
Nada más tiene que agarrarlo.
Ya.
Ok. Un poquito más alto.
Sí.
Qué bonito equipo.
Ahí está.
Entonces, tiene que ser un poquito más para el micrófono, Agara. Gracias.
Ok. Ready.
Listo.
Grabando. Para record, tu nombre completo y organización que trabajas.
Sí, mi nombre es Dr. Howard Ehrman. Fui el comisionado asistente del Departamento de Salud aquí en Chicago por 7 años y yo estoy representando esta red, esta coalición que se llama El Pueblo Responde y también soy parte de un grupo nuevo de la Villita que se llama Vecinos de mi Villita.
Okay. Ay, un poquito para atrás. Ahí. Para darle space a los banners que ponen para que no te tape todo.
Está bien.
Doctor, ¿qué me puede decir qué es lo que está pasando hoy?
La cosa que está pasando hoy, que es más importante, es que ya la ciudad va a escuchar o ya escucharon los padres, los madres. Yo soy un abuelo de 2 nietos que están en las escuelas públicas aquí en Chicago. Los 2 están vacunados completos, pero yo hice la sugerencia a mi hija y mi yerno a no mandarlos a las escuelas porque todavía está peligroso. Está peligroso porque el alcalde y también la comisionada del Departamento de Salud y los jefes de aquí, de las escuelas públicas, no están implementando políticas como en Los Ángeles. No están implementando, por ejemplo, pruebas cada semana. Ellos dijeron hace 3 meses que va a implementarlo y todavía fallaron mucho. La mayoría de los estudiantes, los maestros, otro equipo de las escuelas, no tiene pruebas cada semana, ni tuvo pruebas desde que empezó la escuela. Es número 1. Número 2, fallaron completamente sobre las vacunas. Aquí en Chicago, nada más un tercio de los jóvenes de 12 años a 18 años ya están vacunados, que son estudiantes en las escuelas. La pregunta es ¿por qué? La respuesta es muy simple. En Los Ángeles, desde el 1 de mayo ya empezó a ir a todas las escuelas de los jóvenes, secundarias, otras escuelas, y ya ofrecieron vacunas a todos. Aquí en Chicago nada más tenemos 4 escuelas de 638 que está abierto sin cita. Y no está abierto después de las 5 o 6 de la tarde. ¿Cómo es que un padre que trabaja aquí en el centro, que sale de su trabajo a las 5, puede llegar a ese lugar? Es ridículo. Es un acto de racismo en contra del pueblo latino y afroamericano. Entonces nosotros estamos demandando exactamente la mejor para nuestros hijos, para nuestros nietos, para los maestros. Y es muy simple. Tiene que abrir las escuelas, especialmente en los barrios de los latinos y afroamericanos, donde una familia pueda caminar a la escuela, a recibir su vacuna, a recibir información, recibir ayuda, asistencia, porque ellos no pueden trabajar, tienen que cuidar a sus hijos. Es número 1. Esta existió desde 1850 aquí en Estados Unidos. Pero ya en esta pandemia, ¿qué está diciendo el presidente Biden? Las escuelas tal vez, pero más importante es llevar a sus hijos a su doctor o doctora. Pero mucha gente no tiene doctor o doctora. Mucha gente no pertenece a una clínica. ¿Por qué? Porque en todos los barrios, en todos los códigos postales, en Estados Unidos, de los afroamericanos y latinos y nativoamericanos, hay menos de la mitad clínicas, doctores y farmacias. ¿Cómo es que el presidente va a decir que lleva a su hijo allí? Sale de su trabajo, pierde de su trabajo para llevar a vacunarse en el lugar que en el mismo salón o en la misma escuela que pertenece, ellos pueden recibir su vacuna como yo de 74 años. Esto estamos pidiendo. Y estamos pidiendo que cada padre, que cada familia tiene el derecho democrático que su hijo no tiene que ir a la escuela si ellos creen que no está seguro, que tiene el derecho a enseñarlos en la escuela y que ellos van a recibir enseñanza